Hello, I'm Dr. Aura Gordon. I'm a medical geneticist and internist with unique fellowship training in integrative medicine. My journey to genetics has been interesting. I started out as a genetic counselor when the field of genetics was in its infancy. I liked connecting with people to help them understand complex information and how this could influence their health now and in the future. This led me to attend medical school rather than be a bench researcher because I knew I wanted to apply my knowledge directly to the care of patients. My area of genetics focuses on prevention and wellness care, empowering my patients to take control of their health and risk for disease. As I was finishing medical school, it was a very exciting time in genetics. The BRCA genes were identified and cloned, and it became a reality for the first time to meaningfully assess risk for breast, ovarian, and other cancers, and put into place true preventive strategies. And then the entire human genome was sequenced, and genetics and genomics is now at the forefront of assessing, diagnosing, treating all aspects of a disease, from cancer to cardiac and neurologic disorders and many others. Although I'm a native New Yorker, my medical training, career, and family has been in California. I work primarily between St. John's and Santa Monica and the Disney Cancer Center at St. Joe's. Since joining Providence 8 years ago, I have built a regional adult genetics program in Southern California that is not only the largest in the entire health system, but anywhere on the West Coast. It serves both LA and Orange counties. This allows us to see many more patients than we could at just a single site, and it is really the model for the power of a regional program. There's no turf, just sharing of best practices, and patients can be seen wherever most convenient for them and their families. We take a multidisciplinary approach to genetics, working closely with primary care, surgeons, oncologists, cardiologists. Additionally, we have developed an approach to finding patients at risk through very unique population-based screening programs, and this has been incredibly successful. For example, women in the Providence system who come in for routine mammograms are screened for hereditary cancer risk and are offered same-day genetic testing when that is appropriate. We've conducted genetic risk assessments on well over 100,000 patients and have identified thousands of patients at increased risk who could have more tailored screening and even more who are reassured that they are actually not at high risk. The Providence Genetics Program is really making a difference in the lives of our patients and their family. As a geneticist, my philosophy of care is as a preventionist with a focus on wellness. I treat people who are at risk for or have some very serious diseases and typically have a great deal of anxiety for themselves or their family. Solving the puzzle of genetics takes a lot of time to assess the risk and then individualize care. These are very intense clinical interactions, and I seek to immediately develop a relationship with my patients. I feel so privileged to work as a geneticist for Providence, where I am given the gift of time to spend with my patients and develop a plan of treatment, which includes anything from increased screening, medications, nutrition, exercise, or even surgery. I am honored to work with an amazing team of genetic counselors, and despite very specialized practice, I have the joy of great continuity and long-lasting relationships with my patients.